association with Tyrrells Equine Clinic. Thank you very much for joining us. We're delighted that so many people have signed up to join us tonight, and I'm sure it reflects the ever-present concerns we have about ulcers. I've just been looking at the data actually from the Dengie feed line, and for 2020 compared to 2015, we've seen about a 30% increase in the number of inquiries relating to ulcers. And judging by the questions that we've already had in advance, it seems that tonight's webinar is going to be very useful for many of you out there. Just to outline the format for the evening, Charlotte Ingham will be speaking first, covering the etiology of ulcers, diagnosis, treatment options. I'll then follow on with some nutritional management tips and advice, and at the end we'll do a Q&A session. So if you do have to leave a little bit early, then at least you will have heard all the presentations. I say this every time, but I do ask that you bear with us from a tech perspective. This sort of thing does not come naturally, certainly to me, and I will do my best to try and move seamlessly from one speaker to another. Charlotte has also kindly agreed that we can record the webinar, so it will be available once we've tidied it up a bit, and we will send the link out to you all in the coming days or weeks. I would also like to mention that I'm joined by 𝗕𝗩𝗵𝗵𝗺 this evening. She's our performance horse nutritionist at Dengie, and she's actually going to talk about one of the case studies, as she was the nutritionist that provided the technical support. It's a case study I use quite a lot, so if any of you joined us last week, it is someone that you will recognise, but Claire was actually, as I say, the nutritionist that did the advice for that horse, so I think it's great that she can talk you through it in a bit more detail than I can. I also want to mention that we have another couple of webinars in March. So my colleague Tracy is again linking with Tyrrells Equine Clinic to cover dental issues on March the 10th. And we're also linking up with 𝐿𝐼𝐵P𝗺 Equine Hospital on March the 18th to cover EMS and laminitis. Details of these will be on our social media pages and all held via Zoom. Also, YouTube is where you'll actually find recordings of all the webinars that we've done to date and some talks and things that we did in lockdown 1. So do check that out for some more information. But it is with great pleasure that I'd like to introduce Charlotte. She is an equine veterinary surgeon working at Tyrrells Equine Clinic. They're an equine-only practice situated in rural Hertfordshire. Charlotte qualified from the RVC and has an equestrian background, as you might expect. And she's also successfully competed in British eventing and British dressage. And I'm reliably informed she obtained a temporary jockey licence too, so she's clearly a very brave lady. She was telling me earlier today that she is scoping around 3 to 4 horses a week at least, so I think she's the perfect person to tell us more about gastric ulcers. So I'll hand over to Charlotte now. Thanks, Charlotte.
Great, thanks, Katie. So I will just start sharing my screen to you all. So hopefully you can all see this okay. Thanks, Katie, very much for the introduction. And as Katie said, we're going to be talking about equine gastric ulcers this evening, which I know is a really hot topic at the moment. One I'm constantly getting asked about, and once I'm constantly getting to see horses for. So things I'm going to cover this evening are, I want to first run through the anatomy of the stomach, and then sort of the structure of it, because the horse's stomach isn't as simple as you might think. And then I'm going to run through some risk factors for ulcers, some clinical signs that might indicate that the horse has ulcers, and then we'll go through methods for diagnosing and treatment options. And then finally, ways we can hopefully prevent them coming back or prevent them coming in the first place. So to start with, like I mentioned, we're going to go through the structure of the stomach. So this is a diagram here of an equine stomach, a horse's stomach. So the food comes down this esophagus here, the green tube here, and it enters into the top of the stomach. And the horse's stomach is made up of 2 different types of mucosa. So that light pink area at the top is actually light pink in real life in the horse's stomach, which I'll show you later on in a real picture. And that's called the squamous mucosa. So that's the top part of the stomach. Now, this isn't always in contact with acid. The acid that surrounds the sort of food will sit at the bottom part of the stomach, which is that dark pink area at the bottom. And that's your glandular region. And then between these two parts of the stomach, the top and the bottom, runs this band, which we call the 𝗷𝐴𝐵 plicatus. And then from the bottom part of the stomach, the food moves out and into that small intestine through the outflow tract called the pylorus. So here I just want to mention that the cause of ulcers, no matter where they are, whether they're in the top part of the stomach or the bottom part of the stomach, is acid injury. So it's what causes that acid injury might vary depending on where in the stomach they are, but it is always caused by acid injury, and that's the most important thing to remember. So that takes me on to how ulcers form. So it's slightly different in the two different compartments. The top part, the squamous mucosa, doesn't have the protective mechanisms that that bottom part of the stomach does. And the reason for that is the bottom part of the stomach is made to be in contact with the acid all the time, because it sits at the bottom and it carries that acid. So it has these protective mechanisms at the bottom, but because the top isn't meant to be in contact with it, it doesn't have those. So when you get too much acid, too much volume of acid, or if the pH drops dramatically and the acid at the bottom becomes very, very acidic, when it's then splashed up into that top part of the stomach, there isn't those protective mechanisms to prevent it from causing ulcers. So that's why the top part of the stomach is actually the area that we most commonly see ulcers. And then the reason for the bottom part of the stomach getting ulcers is that there's an actual failure of the protective mechanisms that it has. So it has those protective mechanisms to stop getting ulcers in a normal horse, but those protective mechanisms can fail. And the reasons why they might fail is stress is a big one. So if we're stressed, we don't produce the normal hormones to try and protect the stomach lining. And also the other reason is that if you have a horse on long-term pain relief, we call them non-steroidal anti-inflammatories, such as bute or flunixin, might be common ones that you're using. If we have them on those drugs for long periods of time or at very high doses, those protective mechanisms can actually fail. And that's why then we might see ulcers in the bottom part of that stomach. So then risk factors, ones I wanted to go through that I think are really important is basically most of them apply, as we all well know, to performance horses. So, the common horses that we're looking at that have ulcers, not always, but often are the race horses, your performance horses that are in a high level of work, and your horses that are in sort of high stress environments because the yard's very busy, they're being worked very hard. Isn't always the case, but it's, tends to make them much higher risk. So the first point I wanted to sort of go over was exercise intensity. So it's not just necessarily that the horse is on a stressful yard that can cause it. It can actually be the intensity of the exercise they do. And the theory behind this is that when a horse exercises, if you imagine a racehorse, when they're exercising so intensely, their abdomen will actually contract in between each movement. And that contraction makes the pressure in the abdomen very, very high, which then causes the stomach to basically shrink. And what happens if you imagine that stomach shrinking is the acid level raises up and it comes up to that top part of the stomach, which was, as I was just explaining, doesn't have those protective mechanisms. So we see more and more of those splash injuries of acid along the top part of the stomach. And then the next point I wanted to mention was feeding practices. So this isn't actually what we're feeding them, but it's the routine of feeding them. So horses in the wild and in the natural environment should be trickle feeders. So they should be constantly eating, they should be grazing all the time, and that helps them produce loads and loads of saliva, and that buffers the acid, so it passes down into the stomach and it buffers that acid, and the food actually helps line the stomach and prevent ulcers. But without that occurring and going towards the your classic sort of high performance horses feeding, where they're getting very large volume feeds, then they actually will have periods of time where they're not eating, and that acid in the stomach will increase. So your pH is dropping and is becoming a lot more acidic, and hence much more likely to get ulcers. And then another one to mention here, which I know it sounds really obvious to say, but water availability. And most people are like, well, you know, my horse, of course, it always has water. But there are times where water might not be available. So if you have, if it's freezing, for example, obviously there are long periods of times, potentially overnight, where the horse doesn't have any water because it is frozen. And I know there's not a lot often we can do about that, but it is a risk factor for sure. And then also, it's just important to remember, if your horse is in a herd, there can actually be some herd members that will be quite protective over water sources or feed sources. So it's just important to sort of note that your horse isn't getting bullied away from the water, and that it's not available to them. And then also finally, just like I said with the freezing water, if your horse is particularly sensitive, which I know some horses are, and it's freezing cold and they just suddenly go, oh, it's too cold, I don't want to drink, you know, offering some warm water can actually encourage them to drink a lot, and just encourage them to increase their water intake, just to sort of suppress that acid production and sort of almost dilute it in the stomach. And then the next point, the big one really, is stress. Stress is a huge one. It definitely causes ulcers. And I think there's two different types of stress. There's the environmental stress. So whether that be you've moved your horse to a new yard, or they've lost their field mate, or they're having to be put on box rest because of the weather or because of an injury, they can all massively impact the horse. And then the other type of stress, which I think is important to note here, is physical stress. So if your horse has back pain, or it's suffering with a lameness, or even a mare going through estrus that's particularly painful, that can bring on a lot of physical stress, and then that can manifest in gastric ulcers. And I think that's really important to mention, that I think a lot of people see behavioural issues, and then we find ulcers and we treat them, and they think that's it, the horse will stop these behavioural issues. But actually sometimes there is something underlying, whether that be back pain, ovary pain, a lameness. You know, sometimes there's other causes of ulcer. You know, there's the original cause of ulcers that we actually have to look for. It's not necessarily that the ulcers are always primary. And then diet type, I'm going to sort of shy away from this as much as I can, because I know that Katie will be covering this far better than I can, and Claire. So I will let them talk you through all of this. And then the final one to mention, like I've already said, is the non-steroidal anti-inflammatory drugs, so the bute or the flunixin. So it's important to mention here that these can have a big impact. So it's just really remembering that if your horse is at risk of ulcers or has previously had ulcers, just mention it to your vet, because they may well not know their history. And if your horse has been on long-term bute and then starts showing signs of ulcers, it's definitely worth mentioning it to your vet to have a look into. So that moves us on to nicely signs of gastric ulcers. So these are the signs that you might see, which might indicate to you that your horse is suffering with ulcers. I think it's really, really important to mention here that there is no one sign that is going to make you definitely know that your horse has ulcers. These signs are all fairly general, and they can mean several things, and there's not one of them that's going to make us go, yeah, definitely your horse has ulcers, there's nothing else it could be. So the only way to truly know that your horse has ulcers is to do the gastroscope. But these are some of the signs that we might see that could indicate to us that your horse is suffering with ulcers. So the first one is abdominal pain. One of the more common things that I hear from owners is my horse is suddenly doesn't like me touching its girth area, or they're becoming very girthy when I'm putting the saddle on, or they don't like me grooming their abdomen. Any of these sort of signs, or even sort of recurrent, really mild colic signs, they can all indicate to us that they might be suffering with gastric ulcers. And then I put here poor performance. You know, sometimes it's not necessarily that the horse is actually showing any of the other signs. It's just that they're not quite performing to the ability that we know that they can do. And that way it may well be a good indication that the horse has some discomfort in its abdominal area. I've put poor coat quality here, and there's a picture here of a horse that's actually got very poor coat. You know, horses with a dull coat that isn't looking very healthy, that's always a sign that there is something underlying going on. And again, like I said, it's a very general sign. It doesn't necessarily mean ulcers, but it is just one of the signs that we may well see with gastric ulcers. And then a really important one here as well is weight loss or a failure to gain weight. And I think that goes nicely alongside a reduced appetite. Often you'll find horses, when they have gastric ulcers, they eat, and actually quite shortly afterwards, they can actually have a fair amount of abdominal discomfort from that. Their stomach lining is inflamed, it's very sore. And so they may well not want to eat for a while after they've had a meal, or they may well even get halfway through the meal and want to stop. And it might be subsequent to that that you see weight loss or a failure to gain weight, even when you're sort of offering them as much food as you can. So that's really important to mention to your vet if you are noticing that. And then as I mentioned with poor performance, this can tie in sometimes what owners report to me is that their horses are starting to buck, or they're being very reluctant to go forward, or even reluctant to be ridden at all. So as soon as the saddle goes on their back, you know, they're really getting quite anxious and quite uncomfortable, and that can indicate that they are suffering with pain around that abdominal area. And then the final one is any signs of external stress. So wind sucking, crib biting, box walking, weaving, sort of any of those vices that you're seeing, they all indicate that your horse is suffering with some form of stress, whether that be a physical stress or an environmental stress. Your horse isn't happy in some way, and they're a little bit of a vicious cycle. So your wind sucking and your crib biting, they can increase the chances of having ulcers, but equally it could be ulcers causing these signs because of the discomfort. So definitely worth mentioning these to your vet, especially if there's something new that's developed, and we can have a look into them. So I just wanted to sort of divert a little bit here to mention foals. And I know that probably most of the people watching might not have foals or might not be in contact with foals, but it's definitely worth noting here that gastric ulcers in foals are incredibly common, and they actually can show themselves quite differently to gastric ulcers in adults. So recent studies have shown that up to 22% of foals before weaning have ulcers, and that number rockets following weaning because of how stressful the event can be. But the difference between foals and adults is that they're very rarely primary ulcers, because we haven't got to that stage where we're feeding them the wrong feed or going into the wrong feeding practices. They're usually secondary to something else. So that could be stress because we've had to foster them onto a different mare. It could be that the foal has got pneumonia, or it's got orthopedic problems, so pain in its legs. And it could well manifest itself as developing gastric ulcers. So clinical signs in foals, again, they are different to adults and sometimes quite hard to pick up on. So signs that I have seen in foals that have indicated to me that they may have ulcers is hypersalivation and teeth grinding. And even in one foal, I've had sort of teeth scraping along the wall, because they won't show the signs of wind sucking or crib biting yet. They won't have yet developed that. But these are sort of signs indicating that they're going that way. They're already showing external signs of stress. And then I put diarrhea here, which is, it could be that they've got diarrhea, which has led to the gastric ulcers, or it could well be that they've got gastric ulcers, which has led to diarrhea. But either way, it's an important sign to note. And then signs of colic, which aren't your typical signs always that you see in adult horses. So I have put rolling, but often it's quite a bit calmer than an adult horse. And I think also their size makes it appear quite a bit less dramatic than an adult horse. And And also just lying on their back. You won't see many adult horses do it, but foals love to lie on their back, their legs in the air, and really stretch their abdomens out. And that can be a really good clinical sign to indicate that they are suffering with abdominal pain. And then here I like to mention that poor appetite is quite a good one. And I know that's quite difficult to note in some foals, because if you're just observing your foals and they're getting up and down and they're having lots of feeds, it can appear to you that actually they're perfectly normal. They're going to the mare, they appear to be drinking. But you have to be really careful in closely watching your foal. Is it actually having a proper feed? Is it nursing properly, spending time feeding, and then going and having a rest and a lie down? That's what the foal should be doing. If you have a really restless foal that's getting up, it's getting down, it's drinking, and then it's stopping drinking, and it's wandering around, and then it's going straight back to the mare, there's a problem, whether that be the mare's not letting down milk, or whether that be that the foal is suffering from ulcers and doesn't want to drink because it hurts even though it is hungry. It's just really important to note that the poor appetite and the intermittent nursing or the restlessness does indicate that there's a problem. And then the final point to mention, similar to adult horses, is the failure to gain weight. You know, if your foals should be gaining weight day on day, huge amounts of weight, and if they're not, then that's something that we need to look into definitely. So that takes me nicely onto diagnosis. And I just want to mention there as well that we can diagnose gastric ulcers in foals as well. So you can do a gastroscope in foals. But if we're just talking about adult horses here, so say we've got a horse that's showing a few signs of ulcers. Maybe it's a little bit girthy, it's not gaining weight as we're hoping, and maybe it's being a bit reluctant when it's being ridden. So we decide to go ahead with the gastroscope. So the first thing that we would do is we would starve the horse overnight, and that's to make sure that they have a nice empty stomach, so that when we pass the camera down into there, we can see the whole area of the stomach. So when we arrive in the morning, they've been starved overnight since about sort of early mid-evening the night before, and then the water's been taken out a couple of hours before the gastroscope. And then we try and do ours sort of first thing in the morning, so that the horses aren't having to sort of spend most of the day watching their friends eat while they can't eat. And then what we do is we give them some sedation, and we pass the scope up through their nose, comes to their throat, and they swallow it. It goes down their esophagus and into their stomach. And this is where we get to have a good look around. So I'm just going to try and play you a short clip of a gastroscope so that you can see what a real stomach looks like. So we pass it in here, and here shows quite nicely the two different parts of the stomach. So the very pale pink you see, that's the top part of the stomach, and the dark part, that dark pink there, is the glandular part, the bottom part of the stomach. And that line running around the middle there, that's what we call the 𝗔𝗔. So in this video here, I've already had a good look around the top, and now we've spent our time inflating the stomach with some air, just so that we can have a nice look around. And then what we do is we follow around that band in the middle, that 𝗔𝗔, and while we're still inflating, we come round and we have a look at what we call here the lesser curvature. So the little bubbles you see is just us clearing the screen every now and again. So this here in the middle of the screen, that sort of band you see between the light pink and the dark pink, is that lesser curvature. Now, it's a really common place to get ulcers. So we sometimes pause here and we have a good look. The little pauses that you'll see in the video are just where we're taking screenshots. So we have a good look at that. This is a horse I've been treating for a while for ulcers. So there's still sort of little areas of reddening, but much more improved than the last time I saw it, which is good news. And then you can just see, so that's where we're coming in at the top. That's our scope coming in down from the esophagus. And then just we go a little bit diving here, and then we come up and into the outflow tract. So this leads to the small intestine. So just inside there is that small intestine. So we have a good look around here for any signs. You can see a couple of tiny flecks of red. They're just left over from ulcers that this horse previously had. As I mentioned, we've been treating for a while. And then sometimes, technology. Sometimes what you might see, let's see if it will work or not. 1 second. Sometimes what you might see is that the person, I am going to just put you back onto that, everyone, don't worry. What you might see is that we will have a look inside that small intestine, and then what we'll do is we'll come all the way back out, we'll have a good look around the top, and once we're happy there, we will come back up to the top, we'll deflate the stomach to make sure that all of that air has gone, so that the stomach has deflated, and then we'll come all the way out. And then what we do is we let the horse recover, because obviously they're starving hungry, so they're a little bit sedated still. We spend a bit of time, let me just share my screen again now so you guys can see it, sorry everyone. So we'll spend a little bit of time just letting the horse wake up again. And does someone want to let me know, can you see that okay again? Hopefully you can.
Good, yeah, thanks.
Yeah, you can see it, okay, good. Yeah, we just let them wake up a little bit and recover before we refeed them, which is the part that they love, because obviously by this point they're ravenous. So that's the whole procedure of doing the gastroscope. Now, what I just wanted to mention here is grading of ulcers. So you might hear that, you know, someone will say, oh, my horse has grade 2 ulcers or grade 4 ulcers. Now, it depends on where those ulcers are. So if they are squamous ulcers, so ulcers in that pale pink part at the top, they are graded on a scale of 0 to 4. So 0 obviously being the aim, there's no ulceration, no reddening, no thickening, the perfect stomach, basically. That's what you want to aim for. But I just thought I'd put them up here, the different grades. Now I've put a couple of photos. This top one here, there's a couple of areas that I'd say are sort of very mild grade 1, but then there's definitely maybe this area up here is sort of a grade 2, even maybe pushing a little bit further. And then down at the bottom here, that's a really severe picture. You can see that straight away, this is extensive lesions with areas of deep ulceration. So straight away, this is a grade 4, you know, this is bleeding, this is deep, this is very sore. And that's along that lesser curvature that we had a look at earlier. So that's how we tend to grade them. And the reason why we do that is because what we want to do is we want to do the gastroscope, see the ulcers, do a treatment and repeat that gastroscope and actually see that we've made a difference. And as good as it is having the technology to take photos and videos and look back at them, it's also really good to subjectively choose which grade we would give them, so that we can monitor in our own clinical notes exactly what we think they were last time. And then glandular ulcers, so the ulcers at the bottom part of the stomach around that outflow tract are actually graded on a descriptive method. So we don't give them a scale of 1 to 4. We tend to use these descriptive terms, and also I like to put sort of a mild, moderate and severe alongside that. So this top one that I've put here, actually I'll mention the bottom one first. So this bottom one has 3 here, a little bit more severe. So I'd say these are severe. And then around here, some mild ones, which we actually had a closer look at later. But these are severe, flat, hemorrhagic ulcers. We treated this horse and actually they did go away, which was great. And this top picture, these has a few different ones going on. So I'd say this one here and maybe this one here, they're your flat hemorrhagic ones and they're sort of mild to moderate. These ones here are raised hemorrhagic and they're severe. And this one here is actually sort of a raised fibrinosuppurative, which basically means it's sort of oozing, it's got some loose fibrin, it's sort of like an actual open ulcer. Like I said, these are a bit rarer, but I think it's really good to use the descriptive terms to grade them. So then that leads me on to treatments. So you might have heard of loads of different treatments, but I just wanted to take you through sort of the mainstay, really important ones. So the ones that you're going to be using the most because they are definitely the most effective. So the first one is oral omeprazole. So this is the only one that is licensed in horses for squamous ulcers. So it's the only one that, yeah, like I said, has a license. So it's the first one that we're going to reach for if we have squamous ulcers. So you might have heard of Gastrigard or Ulcergold or Peptazole. There's lots of different names for it, but it is all the same drug and it's given all the same. So it's in a syringe and it's given via the mouth. And there's only sort of the reason why you might not use this straight away for squamous ulcers is because if you've got a horse that's impossible to worm, you know, if the owner's saying, I literally can't get a syringe in its mouth to worm it, then there's no point in trying to rugby tackle that horse on a daily basis to shove a syringe in its mouth when you're already trying to decrease stress in its environment as much as possible. It's sort of absolutely defeating the point. So you may well elect to use the injectable omeprazole straight away. And the other reason why you might use the injectable omeprazole is if you have glandular ulcers. If you know that you have glandular ulcers, there is no licensed product for that. So you can straight away reach for the injectable over the oral if you think that will be the most successful treatment. The injectable omeprazole is given once a week and it has to be given by your vet, whereas the oral omeprazole is given daily. And then the final one I wanted to mention was 𝗕𝗏𝗵𝗿𝗏. So that's a white powder that's given into the mouth twice daily. And it's more, so the top two are proton pump inhibitors. That's what omeprazole is. So it switches off the proton pump and it stops the secretory cells pumping out acid. So that's how they work. And that's why they're the most effective, because they let the stomach acid comes up in pH, so it's less acidic, and it lets those ulcers heal. Whereas 𝗕𝗏𝗵𝗿𝗏 doesn't have an effect on the acid, but what it does do is it acts as a physical barrier. So it is literally like putting a plaster on top of those ulcers just to protect them from having contact with the acid. And actually that just gives them time to heal. So I really like to use that alongside my omeprazole treatment. So if I've got severe ulcers, I may well be using the 𝗕𝗏𝗵𝗿𝗏 and the omeprazole together. And I don't want to go into the other treatments, but people may well have heard of misoprostol being used, or ranitidine, or even antibiotics. And if people are interested in hearing about those, I mean, I'm sure we can mention them in the questions at the end, but they're definitely not the mainstay treatments. And then finally, I just wanted to go over sort of diet and management changes that we can make to prevent ulcers from occurring in the first place, or prevent them from reappearing once we've treated them. So these changes, if your horse does have ulcers, need to be put in place from day one at starting the treatment. These are the most important things that are going to stop the horse just coming straight off the omeprazole and getting ulcers again, or even the horse not even recovering with the omeprazole because their environment just isn't going to help them. So I'm going to try and leave most of the food points and the nutrition points up to Katie and Claire, because I know they'll be far better at explaining them than I can be. But ad lib forage is a really important one. So as I said at the beginning, horses are naturally trickle feeders. They need to be fed constantly. And people say to me when I say that about horses with ulcers, they say, oh, but what if, they're too fat? Well, there are methods of trickle feeding without just absolutely pumping them full of food. So trying to double net your hay nets, or getting very small whole hay nets and hanging 2 or 3 of them in the stable, or even one in the middle of the stable so it's not up against a wall, and the horse has got to then work to get that food. So they're literally salivating all the time, picking at small bits of food, chewing their food for longer, taking more time to actually get more calories in. That's what you want to aim for. So it's not necessarily that you put just a whole bale of hay in there and you go, okay, just keep eating. It's actually just the time they spend eating that's the important thing. And then alfalfa, like I mentioned earlier, I'm not going to talk about it too much because I know that it will be mentioned later, but that is really important to add to the diet with horses that have got ulcers. And then oil is one I just want to briefly mention, because I know it'll probably be mentioned again, but the addition of oil is not only really important for ulcers and improving the healing of them, but also if you do have a horse that you need to gain weight, oil is a really easy, effective way to get in calories and to increase the fat of the diet. And that doesn't mean that they get a sudden sugar hit. It's a slow releasing energy that's a really good way to add calories to the feed and help them gain weight. And then like I mentioned earlier, water is really important. So offering warm water if the horse needs that, making sure that we're breaking the ice in the water as soon as possible, and making sure that your horse actually can access the water. There's no other member of the herd that's stopping them, or it's not so boggy and so horrible around the water trough that they're actually just avoiding it. Really making sure that actually water is accessible to them. And then supplements, I'm not even going to go over them really, because I think that Katie and Claire will be mentioning them in a bit. And then contact, I think this is a really important and understated point. So daily contact with you, with other people, with horses. Your horse is meant to live in a herd, and the way they are going to feel least stressed is by having company. So that doesn't necessarily mean another horse. It may well be another animal, or it may well be you spending daily time with it, or even having a mirror in the stable. It's just so that the horse doesn't feel completely isolated. And although people say, oh, my horse doesn't seem stressed at all when it's on its own and when we leave or when other horses leave, but actually a lot of horses can internalize that stress. So just be aware that actually daily tactile contact can be really important to a horse. And then feeding before exercise. So there have been studies to show that actually feeding a couple of handfuls of chaff or alfalfa before exercising your horse can actually just help prevent some of those splash injuries from the gastric acid. So just bearing that in mind, that you're not sort of starving your horse for a few hours before you ride, because that will only exacerbate the problem. And then rest is an important one to mention, because especially because we mentioned the exercise intensity being a risk factor. Giving your horse 2 days solid rest where they're turned out a week can really decrease the chance of them developing ulcers, especially if they are horses that have previously had them or at high risk of them. And turnout, horses tend to be least stressed when they're turned out. That's not always the case. I know some horses don't enjoy being out, but being turned out is where they are naturally meant to be. So as much as possible, I always trying to encourage people to turn their horses out if they are at risk of gastric ulcers, because it tends to be the place that is best for them. And then reducing stress, like I've mentioned, not making any huge changes to their environment. So try not to, moving yards constantly, or just doing really stressful things, I think. So taking away field mates, or chopping and changing field mates, and changing their feed regularly, or changing their routine regularly. Horses that suffer with stress really like routine. They like to know what time they're being fed, what they're being fed, when they're going out, when they're coming in. And if you can stick to that routine, it really does help them reduce their stress on a daily basis. And then the last one, which I've already mentioned a few times, is to avoid those anti-inflammatory drugs. So to avoid your 𝗵𝗵𝗆𝗏, to avoid your flunexin, or avoid your metacam. Obviously, like I said, it's not always possible. If your horse is colicking, then it's going to need pain relief in sort of a one-off basis. But if your horse is needing long-term pain relief, then there are other options other than anti-inflammatory drugs. So it is something that you just have to mention to your vet and remind them of. And then there's other options that we can look into. So that takes me actually to the end of my talk now. So these are just some references, but I will just stop sharing my screen.
Lovely, Charlotte. Thank you very much. That was brilliant.
Sorry about the technical difficulties.
No, it's Fantastic. It worked a treat, actually. The videos are always fascinating to have a look at, and that was really clear of the two different types of tissue. So thank you for sharing that. That was really interesting. Super. Okay, well, if you're okay, I shall share my screen, see if I can find the presentation. Let's share that. Would have helped if I had it at the start ready, wouldn't it? Okay, so, oops, sorry. Just get it. Bear with me 2 seconds. Okay, now I'm not sure that's working. Bear with me a second and show. Okay, try that one again. Share screen. Perfect. Get there eventually. So just a quick introduction, because I know many of you I've met and spoken to before, but for those of you that don't know me, I've been working as an equine nutritionist now for 20 years. I gained my master's degree with distinction in Equine Science at Writtle College. And during that time, I received the Edgar Pye Scholarship for my dissertation on the effects of prebiotics on racehorses in training. And in 2017, I embarked on my PhD in Veterinary Medicine Research at the University of Glasgow. My role at Dengie is very varied. As Technical and Product Development Manager, I'm responsible for creating new products, ensuring they're legally compliant, and also I sit on the BVET, which is the British Equestrian Trade Association's feed committee. We work very closely with all the regulatory organisations to try and promote best practice in the feed industry. I'm a member of the NOPS working party, so relating to prohibited substances, and I also chair the subcommittee for the BVET approval mark for horses and ponies prone to 𝐒𝐵IS, which I will talk about a bit later on, what that mark actually means. So without further ado, obviously we've talked about ulcers and can we reduce the risk of them. And I'm sort of breaking up the presentation really into sort of 3 sections. So what is good feeding, and in brackets management as well for horses, actually reduce the risk of ulcers. There's a lot of guidance out there, but how effective is it? And what does low starch mean? How low is low? I think there's a lot of terms that don't particularly give us specifics, and to try and put some numbers to things. So when you're actually looking at feed bags or websites and comparing products, to get some sort of hard and fast guidance, if you like, with actual numbers, gives you a bit more of a clue as to what you should be sort of picking out from that range of products that's out there now. And then, as I mentioned, the BVET approval mark for horses prone to 𝐒𝐵IS. What does it mean, and how does a company get it? So I always like to start with this story because, I'm sorry if you have watched previous webinars where it's come up, but it was told to me by the trainer themselves. And I think it shows where we've come to really in the last 20 years with gastric ulcers. This particular horse went on to win the Grand National, but it started life in a different yard with a different trainer. And they found that it would come into work, do all the fitness training, but after about 6 weeks, it would get halfway up the gallops and then stop. And as I say, the knowledge then isn't what it is now. The vets did a thorough investigation, as you would expect, and this was in a yard of a really top trainer, and they found an irregularity with the heart, and that was what was thought to be the cause. So a big trainer, they're not going to waste too much time on a horse that they think isn't going to get past 6 weeks of fitness work. So the horse moved on and actually ended up with 𝐿𝐵𝗵𝗺𝗆𝐿𝐿, and then, as I say, went on to win the Grand National. Now, that's for a trainer definitely a horse that got away. This is a big fish. This is a big prize to potentially lose out on. So he spoke to Gordon and asked, what the particular, how they got over this heart issue, how they dealt with it. But 𝐿𝐵𝗵𝗺𝗆𝐿𝐿 actually revealed it wasn't the heart that was the issue at all. It was gastric ulcers. And that is definitely the one that got away for that trainer. And ever since then, he's paid a lot of attention and a lot more detail to all the elements that Charlotte sort of really touched upon in terms of trying to reduce the risk of ulcers occurring. So these are the sorts of areas that we're going to think about. So it's forage, the bucket feed, how much, the timing, and obviously the management and exercise regimes that we can implement to try and reduce the risk of ulcers. So first of all, does changing the diet work? Have we got some evidence that this is actually going to be beneficial? Well, there was a paper published in 2019 by Nanna Lutherson and in association with some of the Waltham research group. And they compared making a dietary change with or without the 𝐷𝗵𝗿𝗄𝗃 medication. So in other words, the medication was consistent. They're just trying to compare whether if you changed the diet in one group, whether it had a beneficial effect compared to those that were just receiving the medication alone. So with the squamous ulcers, they had exercising horses. There were 12 pairs of horses with grade 2 ulcers, and then 17 pairs with grade 3 or above. And Charlotte's just outlined what those gradings effectively mean. So grade 3 or above, is quite a serious ulceration problem. One of those pairs, they changed to the low starch ration, and we'll talk about how low is low in a minute, but it was less than the 1 gram per kilo body weight. And then the others remained on their usual diet, which actually was quite a high level of starch at 3.5 grams per kilo body weight. All of them received omeprazole for 4 weeks, and then they scoped them at the end of that treatment period, and then again at 10 weeks. Interestingly, in the grade 2 groups, the dietary change hadn't had any effect, but in the grade 3 or worse, both groups improved, but those with a low starch diet, the effect continued, whereas those on the usual diet, the problem worsened again in the second period, i.e. after the medications had stopped. All right, so it does show that, particularly in those very severe cases, all these management and feeding changes that we're recommending are worthwhile. And this is really, sort of one of the few studies we've got where it's quite controlled, and it's actually showing that bothering to change the diet gives you the result that we're looking for, particularly in those severest ulcers. Another study published in 2019 was a retrospective one, and they actually looked at all the ulcer cases that had come into the Ghent University nutritional service that they offer there. So there was 27 records, and they were specifically relating to horses with 𝐼𝐺𝑠. And as a sort of control for the same period, they looked at 21 healthy horse records to compare things like the diet. So in essence, you're taking the healthy horses, or those that, shall we say, don't have ulcers, looking at their diets and then trying to identify the risk factors that those that had got ulcers, those risk factors that were relevant to them. And as I say, this was carried out in Belgium, so just bear that in mind when you see the next slides. I think it is notable that only half of those, only half of those with ulcers were actually underweight. So it's a common symptom and something if you have an underweight horse you're thinking about, but just because your horse isn't underweight doesn't mean to say that it doesn't have ulcers, if that makes sense. Sorry about the double negative, but effectively horses with ulcers can still be those good doers or overweight horses and ponies as well. In a fifth of the ulcer cases, the horses actually received more concentrates than forage. So quite a high proportion actually getting more of the cereal feed or the bucket feed than the forage. In 86% of the cases, there was a forage intake lower than 1.5% of dry matter per kilo body weight. So that's a low ration of a low proportion of forage in the diet. And then nearly half of the cases, it was actually lower than 1%. Now, I think this reflects how, and especially going back the period of time it did, I think it's fair to say the UK horse owning population is generally better and know the importance of feeding fibre and forage. And we would typically find, compared to say some of the European typical feeding practices, that we feed more forage generally, not always enough, but generally more. And I think this slide typifies that, but it just goes to show that low forage intakes are a really significant risk factor for ulcers. And low fibre diets, 20 years on, and they're still a thing. And I've just taken this feeding chart from a UK manufacturer. It's their website's publicly available information, and it's out there as a cereal feed. Really, the sort of bottom right-hand corner is the bit that I find the most interesting, really. A 600 kilo sort of heavy work, so racehorse. The recommended feeding rate for that feed is between 6 and 9 kilos a day. So, that's 1 to sort of 1.5% body weight as this sort of bucket feed or the cereal-based feed. So, I get a lot of trainers that talk about the fact that my horse won't eat much fibre. Well, it's very often because you've filled them up with this sort of level of cereal-based feed. There isn't much room for fibre, and it's not a great surprise they're going to select the cereal mix that's sweeter and it might have molasses coating on there. Lots of reasons why they're going to preferentially take and consume the mix rather than their forage. And they talk about feeding 𝗕𝐵𝗵𝗺 because there's always some left in the stable. It's just because there's no room in the gut left to consume it when you fed them this much cereal-based feed. So it is still a thing, more so at the very sort of elite end of racehorses and performance horses sorts of diets, but it is something we need to be aware of. And fibre does require more chewing, and it's that process that generates the saliva that actually then provides that buffering potential, neutralising potential, to try and counteract some of the continuous acid production that goes on in the horse. So forage is chew time, and we know from really quite old research now that when eating forage, horses are producing around 400 to 480 grams of saliva per 100 grams dry matter consumed, which is around about double what they would produce compared to eating concentrate. So yes, you've got more chewing and you're getting more saliva as a result, double in fact. And it's within that saliva, it's the potassium chloride and the bicarbonate that's actually acting as a neutralizing potential in the gut. So they're helping to counteract that acidity in the stomach. What happens when we don't feed forage? Well, again, sort of collection of different studies have looked at different diets and the reaction or the effect in the gut. The pH of gastric juice has been shown to drop to as low as 2. So the lower the number, the more acidic it is. So a lower pH is actually a more acidic stomach, and even less when feed was withheld for a few hours. Comparing 𝗕𝗩𝗵𝗺, which is quite interesting, the gastric pH was around 3 versus 1.5 in fasted horses. And if we have them out grazing all the time, the pH is around about 4. So kind of what you'd expect. It's got to be slightly acidic in the stomach because it's part of the digestion and the protection process to have a level of acidity there, but it's the extent of the acidity that's key. And as soon as we start to bring them off grass, stop that buffering from the saliva and the diet material coming in, then the acidity will increase or the pH drops. And as it's shown there, some squamous lesions can actually start to form even just after 7 days of bringing a horse off grass, even with 𝗕𝗵𝗵𝗺. So there is definitely something to be said about grass and that free choice access, eating all the time and having that continuous trickle feeding that Charlotte mentioned. Now, it is important to note ulcers might well form, whether they're actually of significance and going to cause, after just 7 days, cause the horse any problems or issues. You could argue probably not, but it's then the length of time that this problem goes on and all the other factors that we put into the mix, so things like exercise, etc., that can really then start to make it an issue that becomes a clinical problem. Timing of forage feeding, well, again, Charlotte touched on even. Can you feed little often with your forage too? We talk about it in terms of the bucket feed, but what about your forage? The study, again, Anna Luthersson and her research group found that if you leave the interval between forage feeding for more than 6 hours, that's increasing a risk of the squamous ulceration. Now, I never know with this picture whether this child is delighted or terrified, but if you don't have a helper to feed a few little handfuls at a time, then there are lots of tips. You can put hay nets all around the stables, so they've got to move between them. You can double net, again, the trickle net scenario, and there are other things you can do to sort of provide fibre without too many calories. The type of material that you're using sort of matters too. Again, touching on this alfalfa, studies back in the 2000s identified the benefits from using it. There were multiple studies, to be fair, really attributed to the fact that alfalfa provides natural buffering because of its abundance of calcium, magnesium and protein. So calcium in particular, alfalfa over and above other forages has a lot more calcium in it, and it's because its roots go very deep down, around about 3 to 4 meters compared to say 1 to 2 for things like grass and cereals. And the calcium that far down in the soils is relatively abundant, and it's easier for the alfalfa to sort of pick that up and take it out of the soil and incorporate it into the plant tissue itself. And that's why it then accumulates the calcium, and it is that then helps to buffer acidity. So over and above all the benefits of the chewing and the saliva production, it's the fact it's got this high level of calcium naturally occurring that helps to buffer acidity as well. And it's also useful in the sense, and just as Charlotte was saying about oil, the better quality forages we can use, the more energy we're getting from a fibre source, the more valuable it is, because if a horse does better on the high fibre materials along with potentially some supplementary oil, the less reliance and the less need there is for starchy cereal-based feed. So alfalfa in its natural state, if you like, actually has around 10 megajoules per kilo digestible energy. So it's about the same as a cool mix or a high fibre cube, but it's only 2% starch. So often it's around about 10 times less starch than a cool mix of the same energy value. So you're getting a lot of energy without the starch that you would get from other typical sort of feeds. So that's one of the reasons why it's useful alongside its natural buffering as well. Alfalfa isn't without its controversies. So back in 2016, we have the UN conference, which is the European workshop on equine nutrition. It's normally held every other year, obviously for fairly obvious reasons. It was postponed from last year, so hopefully it will go ahead this summer. But in 2016, there was a paper that was presented that caused a little bit of confusion, and it did explore the incidence of ulcers in foals and particularly used the weaning process to induce those ulcers, which has been demonstrated to occur in previous studies. And Charlotte covered this beautifully for me, saying that foals are very prone to ulcers for all sorts of reasons, and they can often be secondary to other issues. So it's an interesting group of subjects, if you like, to use for an ulcer trial. They then actually compared the groups. One lot was fed alfalfa chaff and then alfalfa pellets to another group, or hay. Now, and I think this is where problems sort of occur and misunderstandings can occur, because you can get some headline results and that's what then gets shared around. But actually, when you look at the detail, this was a very exaggerated level of feed. So in the trial, the foals were actually fed 3 kilos of the chopped alfalfa, and that equates to 7.5 stub scoops. If you have the round, large, bowl-shaped scoop, there was about 7.5 of those. Now, I can very rarely get somebody to feed a 500-600 kilo horse that kind of level, never mind a foal. So yes, I know in research terms, you're always going to try and set up your research study to find an effect or find a result, so you give it every opportunity. But I think that's what we need to take into context compared to a real world situation. Nobody is feeding that level of chaff typically to a foal. And alongside that, they were then also given 2.7 kilos of oats and 0.25 kilos of the soybean meal. So yes, I accept that obviously the variable between the groups was the format of the alfalfa, but they were all still getting a very high level of, or what I consider a high level of cereals and therefore starch alongside it. And interestingly, the alfalfa chaff that was used in the trial was around about 40% lower in calcium than the alfalfa pellets that we used. So I think that's an interesting thing that we should also take into consideration as well. None of the foals in that study actually displayed any clinical signs of ulcers, according to the researchers. And in the foals fed the alfalfa chaff, there were higher ulcer scores in the EGGD, so the pyloric region, for those, but only those compared to, those that were fed pellets or hay, but only that region. So it wasn't the squamous region, it was just the sort of glandular region. Now, interestingly, again, more recently, the same research group have actually published a study in adult horses comparing grass and alfalfa hay. They changed the management regime of the animals 24 hours before the study began, which Charlotte's highlighted is a risk factor if we start to change management regimes. But the one horse with ulcers at the start no longer had ulcers when fed the alfalfa hay. So there was a real positive benefit from feeding the alfalfa hay in this study, which really then supports the work that was done sort of in the early 2000s. And the authors themselves concluded that the alfalfa hay seemed to have a beneficial effect on that squamous mucosa. Interestingly, there was no effect at all in that glandular sort of pyloric region of the stomach. So what can we conclude from this really? What are we going to take away? Well, there's no negative effect in the squamous region in any age. So the only negative finding to date is in those weaned foals. They were obviously stressed. It was in the pyloric region only, and it was arguably, well, not arguably, unarguably, when fed much higher levels of alfalfa chaff than typically used. So, is that a fair reflection? Alfalfa chaff, therefore, in our opinion, is absolutely fine and generally considered to be beneficial for the adult horses. As I say, the same research group are advocating it and found a positive effect. So if none of this still convinces you that alfalfa is fine, if you are really genuinely concerned, at the time of weaning, when those foals are particularly stressed, you can just switch them to the alfalfa pellets and use something like a grass chop if you want to. You still get the buffering from the pellets, but if you are concerned, that is your alternative option. What about other forages? So I touched on the fact that, and again, Charlotte mentioned the problem with trying to feed these horses lots of forage, because if they are good doers, and as we said, not all horses that have ulcers are underweight, some can be overweight. What can we do about it? What about other forages? Are they safe to use? Well, another factor that is often said to be a risk is straw. But again, you've got to look at the detail, because the study where straw was found to be a risk factor, they were basically fed straw as pretty much the sole forage source. And yes, they did see a 4.5-fold higher likelihood of gastric lesions of grade 2 or above, but it's rarely used as the sole forage source for horses in the UK. And in actual fact, it can be a really useful way to provide fibre without too many calories for those good doers, and the benefits of a higher fibre intake are obvious, from the saliva and the chewing and all those other benefits from chewing more. We've done some sort of calculations recently, and if you put straw in up to 30% inclusion in the total forage ration, using average values for hay and straw, it equates to, if you're replacing hay with 30% straw, about a 16% reduction in calorie intake. So it's not insignificant. And as long as your horse doesn't have a history of impaction colics or have dental issues that might cause him to choke because he can't chew it properly, the vast majority of horses could really benefit from a proportion of straw in their ration. Now, obviously, it's a commonly used feed material in chopped fibres and even actually also in mixes. You can see straw pellets and things used to dilute other ingredients, but you can use it as your forage. So, as part of your forage. So if you want to introduce it gradually, you can soak it in the same way as you do your hay, use an oat straw. It's basically, something that you can mix in with your hay, and potentially if you've got an haylage then on a yard where you have no alternative, straw can be a really useful way of diluting that if it's almost too calorific for your particular horse or pony. So again, devil in the detail really. If it's the sole forage source, it's a risk factor, but it's a useful part of a ration if it's used at up to 30%. So as horse owners, we often know what it is that we're supposed to be doing, and we carried out a survey with Horse and Hound a couple of years ago now. A reasonable level of response, sort of 275 people participated in it, and we were just trying to identify the sort of management strategies that people were most familiar with in terms of trying to reduce the risk of EGIS. And as you can see there, really good levels and understanding of trying to feed more fibre and forage, which is fantastic. 96% of people tick that box to show that yes, they knew it was a strategy for reducing EGIS, and turning out as much as possible, trying to avoid the stressful situations, and indeed feeding a double handful of fibre 20 minutes or so before exercise. So that's all really positive stuff. But then the next questions or set of questions were, which of these can you actually, or do you actually implement? Things start to fall away a little bit. So we're just not always quite so good or able, in some cases, at doing what we're supposed to be doing. So of the people that answered the survey, 61% knew or thought their horse had ulcers. So, that's great. You're sort of aware of what you need to be doing. But even if you suspect your horses have ulcers, only 2/3 of people were actually increasing their access to hay and fibre. And to be fair, we didn't ask, is this because you have an overweight horse or pony, so you don't want to feed quite so much hay and fibre? So there is could be a valid reason why they weren't, such as the horse or pony being a good doer. But again, less than 2/3 were actually avoiding starch or cereals altogether. And I would say there's a very small minority of horses and ponies that we can't feed without having to use cereals. So I think that remaining 38%, we could have probably helped them, the 62%, yeah, it was the remaining 38% that weren't avoiding it. We could have helped them get a ration that was lower in starch or avoided it altogether. Increasing turnout. Now, I can sympathise with this. I've been on livery yards where, if it's really wet or snow or whatever, for whatever reason, you can't turn out. So it isn't always possible to increase turnout. But there's really no excuses for people not to feed the sort of double handful of fibre shortly before riding, and only really just over half were actually doing it. So yes, there are some genuine reasons why we can't implement some of these strategies, but perhaps some areas where we could do better on our school report. So again, some sort of take-home messages about forage, what we need to try and aim for and what we need to try and do. If we can aim for 1.5% of body weight as the minimum amount of forage to be fed, not like those horses in Belgium, we need to use more of lower calorie forages for good doers rather than restrict the total intake. So, if you want to get your forage analysed to work out what it's contributing to your horse's ration, try and find some lower calorie forages. As a guide, the more like straw a hay looks, the more like straw the hay will be nutritionally. And if you squeeze it in your hand, if it's quite coarse and fibrous, it's likely to be less digestible, which means it's going to pretty much be lower calorie. Straw is acceptable as part of a mixed forage ration, so around about 30%, and try to keep the time without forage to a minimum, so no more than 6 hours. I appreciate that's not always possible in the middle of the night, especially if you don't have your horses at home, etc. But if you can share a late night sort of rota with some other people on the yard, so you can put something in if you have to go at 4 p.m. or something like that. If someone's there later at 8, 9 p.m, maybe they could put a little small hay net in for you then. The more effort you can put in, it will pay dividends in trying to avoid the risk of ulcers. And you can use chopped alfalfa. Hopefully we've convinced you that it has those proven benefits and is well worth doing. But if you are still very concerned, then at weaning, try a grass chop with alfalfa pellets for some buffering. So that sort of covers off the forage side of things. If we have a look at, obviously the rest of the diet matters too. And it's really this strategy of trying to reduce the amount of starch and covering off the sort of how low is low. So in the studies that have been done, feeding 1% of body weight as grain resulted in marked increase in ulcers, even in non-exercised horses. So, and in that study, it was around about 3.7 to 5.1 kilos of grain. And that's around about 3 scoops, the stub scoops of mix when we're looking at the 3.7 kilos. Now, the recommendation, this is the research level that's been shown to increase the risk of ulcers. So we try to aim to be below these levels, it's 2 grams per kilo body weight of starch per day and 1 gram per kilo body weight starch per meal. And there's a slightly higher risk when you put more starch into the meal, so 2.6 times as opposed to doubling when you look at the total amount fed in a day. So both are risk factors, but the amount per meal is slightly worse. So if you are going to feed high levels of starch, the bare minimum thing you can do is divide it into as many small meals as you possibly can. So at least the amount of starch the horse is consuming one time might well start to come down a bit. And it's this sort of information, is 2 and the 1 grams, that really forms the basis of the beta VGUS mark, which I'll talk about a bit later on. The use of oil. So, and this is where, again, there's lots of papers that can cause us a bit of confusion, because there are some studies that have really shown an effect and a benefit, and some that have shown no effect at all. Having said that, obviously, the corn and the maize oil seems to be the most often recommended. But effectively, in purely energy terms, so if we're going to use oil as an energy source rather than resorting to starch, then they're basically the same sort of energy value. Now, there are lots of different attributes and qualities of oil, so they vary on other parameters, and there'd be certain reasons why we'd use one over another, but effectively the energy they're contributing is basically the same. So as I mentioned, corn and maize oil is often recommended, but in the paper that was actually done, the rationale for the use of the oil was really because of the high linoleic acid content, which I've sort of highlighted here. And this original study that is referenced quite a bit by some of the vets and researchers that sort of advocate the use of oil, this was actually in relation to 𝗔𝗔𝗔. So in this case, you can see at the bottom there, associated with long-term use of the 𝗕𝗵𝗵𝗺s, the non-steroidals. And they were looking at linoleic acid content. If that's the rationale for using the oil, then other oils actually have more linoleic content than the corn or maize oil does, so soya, for example. So, you know, in that sense, I don't think we have to be restricted to particularly using maize or corn oil. If you're just looking for a linoleic source, then you could use things like soya for the same reasons. But it is important to note that that study was relating to the sorts of ulcers related to long-term use of 𝗵𝗵𝗆. Again, just looking at things like energy and starch and trying to help you sort of explain what is low. Here is just a selection of feeds taken all around the 12 to 13.5 megajoules per kilo. So this is high energy feeds. Now, when we talk about energy is the same thing, whether it's for weight gain or for work or whatever. Now we tend to, and I'm just as guilty of it as the next person, tend to talk in terms of calories when we're referring to energy to try and promote weight gain. And really, what we're talking about is slow release energy sources that are more likely to put condition on without fizzing a horse up. When we're looking at energy for sort of work, then we tend to talk about energy, and we're probably more likely to be talking about things like quick release energy that comes from starch and the cereal-based feeds, and to some extent some sugar as well. So energy is energy. You can see from the types of feeds here, they might be high energy because they're being promoted for conditioning, or they might be higher energy because they're being used for competitions and work, but they're all in that 12 to 13.5 megajoules per kilo. Bear in mind that a cool mix is around about 10, and something like 𝗕𝗵𝗿𝗆 light is around about 7.5, something like that. So you can see the sort of scale that we're working on, and look at the levels of the variability in the starch that you get for the same level of energy. Okay, so the two aren't necessarily going hand in hand. You can have very low levels of starches in something like alpha oil, which is 2%, and any alfalfa and oil combination is going to be down there. And then at the very extreme, you can have some cereal-based feeds that are up around 36% starch. So that's why, energy is obviously one measure, but starch is separate to that, and that's why we need to focus on the starch. So I would suggest that something that's properly low in starch is around about 2%. Anything getting above 25 and up to 30% is high starch. And then, as you'll see from the next slide, many of the next generation of cereal-based feeds, if you like, or mixes and cubes are around about 15 to 18%. The lowest one I could find with a quick sort of scan through websites and things recently is 8%. So it's still 4 times higher than a fibre and oil combination with the same energy value. All right, now 8% is great when you compare it to some of those other cereal-based feeds, but context is everything. What are you comparing it to? And an example ingredient list of that 8% starch sort of product, you can see the top couple of ingredients are basically fibre sources, soya hull and dried sugar beet pulp, a fibre. You've got a couple of flakes in there. Peas and soy are going to be contributing some protein, obviously from good quality sort of legume sources. There's a little bit of molasses to make it palatable. Then we're back to fibre because it's grass, and there's your oil and some premix. So they're just taking the different sources of fibre, putting them with a bit of a coating and a premix and creating a feed. So it's not got the cereals and things in that traditional mixes and cubes would have, but it looks like a mix to your eye because it's got some flakes and pellets and things in there. But you can create that mix yourself by using straights and a balancer if you want to. Exercise, so again, this is another factor that is going to contribute to this ulcer risk. The Australian study showed that a risk of ulcers increased by 1.7 times for every week of training. You remember that Rachel story right back at the beginning. After 6 weeks, you've got a significant risk, and it's when the problems really become apparent. Again, Charlotte touched on the fact that your abdominal pressure and your decreased stomach volume is part of the problem when you're exercising the horse, and as a result, your levels of acidity are actually increasing as your work intensity goes up as well. And those changes are less noticeable when you've got food in the stomach. It is there for a reason. So this feeding before exercise is extremely important. And again, just to highlight with the EGGD, so that sort of glandular issue, the consensus statement that has been published in the last couple of years, and I think it's fair to say we're still learning all the contributing factors that kind of result in EGGD. They're showing that there is, or still stating there's no real link between EGGD and the diet. Having said that, it's still good practice to do all the things that you would do for a horse with ESGD, the squamous version, but there isn't that sort of quite so tangible link between what you do with diet and EGGD. But as you can see there from the consensus statement, the advice is still very much to try and minimise stress, turn out if the horse is happy there, and use your fibre. Interesting, they also advocate a couple of days off of work every week. Some trainers are, shall we say, less keen to do that than others because it's another day of fitness training and things that you're sort of losing from their preparation. But it certainly is or has been shown in a couple of studies to be beneficial. One of those studies actually looked at some polo ponies. It was done in Canada, and they showed that the horses that were had less risk of the EGGD, which implies that they've either kind of got so used to the stress of being a polo pony, doing competitions and traveling and all the intense exercise that they do. And the other flip side of that might be that all those that can't cope with it fall by the wayside and end up in different careers and doing different jobs. And so, don't tend to end up, being an ulcer case in a polo yard. So there's always, two possible sides to the story. And these things, I think are areas that we'll see more on in terms of research and sort of things to consider and just think about. They're not necessarily kind of set in stone as absolute principles or concepts, but they're just things that we need to be aware of and we're starting to see the effects of, and maybe will come to the fore more in the next sort of 5 to 10 years. But there's been one study, so it is preliminary work, that's certainly indicated the effect of using omeprazole is a reduction in calcium absorption. Now, it's certainly seen in humans and it is a thing in humans, but we're just starting to see the effects happening in horses too. So this was again published in 2019 by Swanhall et al. Now, some trainers have sort of got hold of this, and there is a school of thought that that may well be contributing to bone demineralization, which potentially increases the risk of fractures in your elite sports and performance horses. But that's quite a leap. We certainly haven't got that far yet. We're showing that there is a reduction in calcium absorption, but we can't sort of say categorically that is what's causing a risk of fracture. But certainly the recommendation from those researchers is it's wise to increase calcium intake in horses receiving omeprazole over and above the fact that it is also then a buffer to acidity in the stomach. Alfalfa is a great way to achieve that. It's more bioavailable than the calcium from things like limestone flour and sugar beets and some of the seaweeds and things like that. Again, other good sort of sources of plant calcium, shall we say, or calcium from plants, so going to be more bioavailable. And that's certainly worth considering, and I think probably is another reason why trainers are starting to use a little bit more fibre in the ration. And also, again, some more work done in humans where the change in acidity levels, so through all these sort of acidity buffering and sort of reducing acid production medications, is actually starting to change the acidity levels, which potentially can allow some harmful pathogenic bacteria to come through the gut. And in humans have been some studies looking at this. So it could make us more vulnerable to those harmful bacteria. And again, if you think of the horses most likely to be on omeprazole and other those sorts of drugs for the longest, it's going to be the racehorse, who probably travels more than the average horse, certainly comes into contact with more other horses and is potentially vulnerable to more pathogenic bacteria that is exposed to those that it wouldn't be in its home environment. So again, many variables to think about in that, in terms of length of use, the diet, and all those other contributing factors, but they're just some things to be mindful of. So I just thought to pick out a few sort of scenarios. We've had some questions in advance, so just covering off some of those as well. So if we've got a good doer with ulcers, then the real challenge, even if they haven't got ulcers, is trying to find a way of getting enough forage into them to keep them healthy and occupied. But it becomes even more important to do that when the horse is vulnerable to ulceration. So again, consider that hay and straw mix. So we're getting fibre for less calories, minimum 1.5% body weight as forage per day. And then all you need alongside that is a balance or a supplement that's appropriate for the level of work or the physiological status. If it's a reproductive animal, then you need to think about those sorts of requirements. But other than that, it doesn't need to be any more complicated or difficult. So forage, low calorie forage, try and hit that 1.5%, and then just balance the ration. When we come to the poor doers, it becomes a little bit harder in the sense that we're trying to put energy into them to promote weight gain in a way that doesn't exacerbate the ulcers. Now, forages, we tend to use the term wrapped hay really to describe some of these, I suppose, more recent forms of what has been called haylage. So a typical traditional haylage would be somewhere in the region of, say, 55 to 65% dry matter. So, in some cases, it could be half of it is water. They do then ferment, and you get a level of acidity as a result. That's what fermentation gives you, is acid. So these wrapped hays are actually dried almost to the point of being a hay. So they're around, quite often 75 and even 80% dry matter. When they're wrapped, they're too dry to actually ferment. So that's where the term sort of wrapped hay comes from. And so they don't have any increase in acidity really compared to an unwrapped hay, and the sugar levels and all those other nutritional values are still the same. That's how we know the fermentation hasn't really occurred, because there's no acidity and the sugar is still there. So if it's a softer forage and it's more digestible, the horse is likely to do better on it, and therefore your reliance on other potentially more harmful feeds is reduced. So if we could make more use of a good quality forage, feed it ad lib, that would be in most cases an advisable place to start for a poor doer, and obviously turning out if you can. And then what else can we start to put in there? Well, we've mentioned the alfalfa with oil because it's high calorie, so up there at about 12.5 megajoules, with the really low starch levels, certainly compared to a cereal-based conditioning mix. You can start to add in things like sugar beet in an unmolassed form. It's a great source of highly digestible fibre. So the horse can break it down very easily. You can feed it as a mash, so it tends to be quite palatable. And for a 500 kilo horse, you're probably looking at around about 2.5 kilos per day. And in the context of alfalfa with oil, that's around about 5 to 6 scoops. So there's lots of chew time coming from that fibre. Again, you can put your own balancer or supplement alongside it to balance the ration. And if you want to, you can look at things like digestive enhancer supplements, because these are really focusing on trying to improve the fibre digestion. They're not necessarily treating or managing the ulcers, but what we're trying to do is increase the amount of calories or energy the horse can get from the forage, so we don't have to use other things that are going to increase the risk of ulcers. And that's really the strategy with the 𝗕𝗄𝗏. Now, feeding 𝗕𝗄𝗏s with ulcers, they're not always old. So diastema is an issue that's increasingly diagnosed. In these scenarios, we tend to use soft chops, so things that are grass-based. If we can't manage the chopped fibre, then we're moving down to a pelleted form of fibre and soaking it up. So it is a mash and a slop that's very easy to eat. Obviously, the alfalfa pellets are going to provide the buffering, but they're almost too nutritious to use as a complete hay replacer. So in this scenario, you might start to use grass pellets and alfalfa pellets together. And you do have to feed those on a weight-for-weight basis. So if you were feeding 10 kilos of hay, you've got to put 10 kilos of your hay replacer in to ensure the fibre is being provided. Now, here is our case study. I'm going to see if I can find Claire and if she's going to just talk you through this case study, because as I say, she did all the technical support for 𝗕𝐴𝐿 and the horse is called Pooh, or that's what I know it as. So over to you for a minute, Claire, if you're happy to just tell us about.
Yeah, this is Perfect Timing the Second, I think that's her full name, otherwise known as Pooh. She is, I think, 13 years old this time, and we can see here, this is her at Tats over in Ireland, competing. But this horse I first went to see back in 2016, I think it was, and she was suffering from some issues. She's got a problem called diastemas, which are gaps between her teeth, but this was causing some food to impact and became very, very painful, and so she wasn't able to eat very well, and actually was made worse sort of because she had quite a high proportion of her feed was a chopped fibre, and this was getting stuck between her teeth and became quite painful. So she had some dental work, the vets got involved, but the horse was very, very lean, and her owner was very concerned that she wasn't going to be able to sort of progress through the levels of venting. She was certainly struggling with her energy levels and maintaining condition. So we looked to provide the ingredients of her bucket feed in a different format. So as I say, she did have some dental work done to help improve things, but that alone wasn't enough. We needed to change her feed. So we put her on a what her owner calls a bucket of slop. So it combined some grass pellets with our 𝐷𝐵𝗵𝗺, which is a combination of alfalfa and unmolassed sugar beet, and we were able to use these in a combination to provide her with the calories that she needed, and we also provided a balancer to give her the vitamins and minerals that she needs. Once we changed her feed, she started to gain weight and didn't look back really. We have to keep sort of monitoring her, and there was a little bit of a blip in 2017 where her teeth had sort of become more food had got packed in again. So in the sort of early spring in 2017, we had to again look at just replacing some of her forage again and increasing her bucket feed. But she went on to compete that year at the 8 and 9-year-old champs at I can't think of the horse trials. In the autumn anyway, she went on and completed that, and did really, really well. So you can see that even though she's got some dental problems that have affected her, if we get her diet right, then you can see she can go on, and actually this fibre diet fueled her energy requirements even when she was competing at sort of, you know, the old 3-star or now 4-star level. And you can see from the picture how well she's looking.
Brilliant, thanks Claire. No, I think she looks fabulous, doesn't she? And it just goes to show, even with potentially issues, if you get the diet right, they don't have to be a barrier to looking and performing, you know, at really high levels. So that's fab, thank you. So just to finish off our presentation before we go to the Q&As, I just wanted to talk you through the beta approval mark for products suitable for horses prone to gastric ulcers. Basically, we have to sort of work it through an organisation called the Veterinary Medicines Directorate. So they are the authority that regulate all sorts of medicines, and they stop people who have products that are not medicines from making medicinal claims. So they are very strict on that, because quite rightly, it takes a lot of time and effort to license a medicine, and it's not then fair if nutritional products or similar things come along and try and claim or, you know, sort of set themselves out to be medicinal. So the BMD are you know, rightly so, very strict on these sorts of things. But it is important that we try to find ways to identify products that are feeds that are suitable for horses with particular issues. And this is really what this mark sets out to do. So it's about trying to find a product that's suitable for, but it wouldn't treat, cure, or prevent disease. You know, if anyone uses that sort of terminology or implies it, they really are, you know, crossing the line, and that would be considered to be an illegal statement. So there is an annual license fee, but it's relatively reasonable to apply, and it covers things like beta's administration times and you know, the analysis that needs to be done to check the feeds or the claims being made about the feed are in fact correct. And as I said earlier, it really follows that providing less than 2 grams of starch per kilo body weight per day and 1 gram per meal. But it is important to stress as well that it's not imposing any requirement for a positive inclusion of ingredients. So we're not saying it has to have this in it to be approved, or it has to have ingredient X in there. It's more about what isn't in there, basically. So it's highlighting these feeds that are low starch, and therefore, you know, on the basis of what we know from evidence from studies and research, that is going to be a less risky feed to use. Supplements, I think it's important again to highlight that technically in feed legislation terms, they don't exist. They're just the same as a feed. And, you know, we work collaboratively with a lot of supplement companies. We've done some webinars with NAF in the autumn last year, and 𝐊𝐴, their technical manager and senior nutritionist there, would always say that, you know, a supplement doesn't exist, it is a feed, and it comes under the same rules and the same legislation. Having said that, the BMD have a slightly uneasy relationship with supplements, as in their opinion it can often appear medicinal just by presentation, and it was their requirement that they weren't included in this particular scheme. It is very much what they consider to be a feed, so a bag rather than a tub. It's not beta trying to be discriminatory in any way. And as we said, companies should only be using phrases like maintaining gastric health. You can talk about natural buffers to acidity, but you have to have evidence to substantiate your claims. So the fact that alfalfa is a natural buffer, and that's what's included in the product. You can't just make a claim and not have any evidence to support it. And on to supplements, really, we've had questions about them. I've just picked out some of the more common ones that come up on Feedline, and obviously if any of you are asking particular questions about them, we will try and cover some in the Q&A or follow up later with emails to you. A very recent study actually published last year by Frank Andrews' research group showed that the use of turmeric didn't cause or worsen ulcers with 28 days of feeding. And again, I think we need to bear in mind that was 1 month that they used it for. That's not to say that if you then used it for 6 months, there wouldn't be a problem. This is likely there might not be, but the period of time that they used it for a month, there was no issue with it causing or worsening ulcers in the horses that they tested. When I sort of, again, dug around a little bit in the background for that supplement, and they actually used a product called Smart and Simple Turmeric Pellets, because this is an American research group. There wasn't any piperine that I could see on the ingredient list of that product. But again, you know, I'm trying to do it via a website rather than actually having the product packaging in front of me. So, you know, that's an important thing. It was just pure turmeric. So again, we need to keep it in perspective. I mentioned seaweed, again, commonly used because it's another source of calcium and it appears to act as a buffer in the stomach. So, you know, a bit of a rationale for using that potentially. And, you know, it is a source of other vitamins and minerals. If it's not a sort of balanced product, it is important to bear in mind that it isn't, you know, necessarily for a horse in the UK. So, you know, you may want to look at the ration a bit more completely and get some advice from a nutritionist as to whether it's, you know, going to be alongside something else and not just the sole source of vitamins and minerals that you're using. Again, FOS prebiotics. So there are some published studies relating to FOS prebiotics, and FOS stands for fructooligosaccharides. So oligosaccharides means a few sugars, so they're little short chains of sugars, and by their very nature of how they're constructed, they're only broken down by beneficial bacteria in the gut. So originally, we used to think prebiotics were really beneficial from a sort of hindgut perspective, where most of the microbes live in the digestive system. But some of this work that was done by Respondek et al. Back in 2005, I think was published around then, actually showed that there was some benefit or effect in the stomach as well, and that it was actually sort of increasing the numbers of bacteria that mop up some of the acidity. So lactic acid utilizing bacteria, if you want the sort of full name. So again, that was at the time a little bit more of a surprising result, that it actually had an effect in the horse's stomach, but potentially, you know, again, the researchers are talking about it having a possible regulatory effect on acidity levels in the stomach. So and other benefits have been demonstrated in other species as well. So again, a little bit of a rationale for including some FOS prebiotics in there as well. They're some of the most common ones. There's lots of supplements out there. You know, do speak to a nutritionist. They can evaluate products for you. It's important that you look not only at the inclusion rate, but things like the feeding rates and what evidence actually exists to support the use of that ingredient at that level that that product is giving you. And it can involve a little bit of maths. And if that's not your forte, then, you know, most of the feed lines, so the, you know, the bigger feed companies will help you investigate that and do some comparisons for you. So that brings us to any questions. So if I stop sharing, hopefully we will find Claire and Charlotte. And there's lots of questions been coming in, Charlotte. So Claire,
having a look.
You're very welcome to join us, Claire, as well, if you would like to, or you can stay hidden away. But Charlotte, if you don't mind, I'll fire some questions at you, if that's all right.
Oh, yeah, go for it.
Perfect. Okay, so another good question, actually, in terms of the long-term use of things like bute, what would you consider as sort of long-term?
I think it depends on what dose you're using them at. So say if you're using them at a low dose, so for example, a 500 kilo horse, so a standard sort of small thoroughbred, 1 sachet a day is a fairly low end dose for that horse. So I would say that a long-term use of that is sort of over 2 weeks. But if you're having to use the higher end of the dose, so more sachets in a day, then, you know, even a week could be classed as a high dose. And every horse is going to respond differently to that. So some horses could be on bute for years and have no problems. Some horses could be on bute for a week and suddenly develop a problem. So it isn't unfortunately arbitrary. It is actually sort of horse dependent, really.
Okay, lovely, thank you. Why is crib biting a sign of ulcers? Do you want to elaborate a little bit on that one?
Because crib biting can be a sign of stress, quite simply. So sometimes the reason why they start it can be stress or even boredom. And boredom, which can lead to then stress, again causes ulcers. And I did notice that there was a question before that says, how does stress actually cause ulcers? And it is a little bit technological, so I didn't really know whether to go into it in my talk or not, but stress suppresses what we call prostaglandins, which are released, and prostaglandins have all different mechanisms around the body, but one of their main mechanisms is protection of the gut lining. So if we suppress those prostaglandins, which is what bute does and what stress does, then you lose that protective mechanism, and that's when the gut lining will get damaged. So you know, crib signing is a sign of ulcers because your horse is exhibiting some signs of stress. So then your prostaglandins aren't being produced, and your lining of the stomach is much more risk of having damage.
Excellent, thank you. And I'm just going to answer that one. Would feeding before a stressful situation such as travelling help with prevention? I think we'd probably all say yes, because any form of movement or stress, the more we can potentially buffer or provide a fibrous mat is generally a good thing. And obviously fibre is the best sort of option for that, rather than feeding cereals before you travel. Here we go. Do they have to be scoped at the surgery, or can it be done at the yard?
So it depends on which vet you ask. I think you have to have power. That's one that's quite important, and obviously there needs to be somewhere appropriate to starve them. I must admit, I don't think I've ever seen a horse that's been successfully starved on a straw bed. Like the number of gastroscopes I've done, I've got the scope in there and there's a full stomach of straw. So either your horse needs to be in a straw bed with a muzzle on, or it needs to be on a shavings bed or a wood chip bed or something that they're just not going to be tempted to eat, because then it's incredibly frustrating that you've got to go and try and starve them again and do it all again. So I do scope things on the yard regularly. If there is power available, an appropriate stable, they've been starved properly, I don't have a problem with it at all. But obviously you've got to ask your own vets, because they might not be comfortable doing that.
Yeah, excellent. Claire, do you want to mention your Weightbridge before and after withholding feed, your data from that?
Yeah, so we weighed some horses before they were starved, and then the morning of their scope, so after they'd been starved overnight. We found sort of on average there was about just over 20 kilos difference, which I just think shows how much sort of weight that fibre is contributing when it's sitting in their gut. So I thought it was quite interesting sort of looking at them before and after.
Well, when you consider that's a whole bag of feed, basically, isn't it? A 20-kilo bag, and that's been in their digestive system. So yeah, it's always, I find it really interesting. What else have we got in here? Are horses that have had a diagnosis but now clear for ulcers, are they going to be more susceptible to it? I think a few people have actually asked that. Will that bring ulcers back? And sort of almost also, Charlotte, sorry, giving you 3 questions in one go. I think this is quite topical, really, with the recent snow and icy weather. Do you think that could have impacted as well on bringing ulcers back again? Would that be sufficient to have caused it?
So definitely horses that have had gastric ulcers are going to be at higher risk. You know, it's the same as humans. Some people or some horses have much more sensitive stomachs than other people or other horses. So I think once you know they've been present, you're going to have to be really careful and really strict with keeping stress levels low, keeping your feeding regime very routine, and keeping sort of everything as constant as possible. And I think I'm not sure if it's actually been shown, but definitely what I see in practice is the further they go away from having ulcers, so say they're years and years on, the less likely they are to recur. Obviously, you know, if it's only a month on, the chances are that they're going to recur much quicker because that lining may not have healed completely yet. So there may still be some weaknesses in that lining. And then with regards to the frost and the snow, I mean, as I mentioned, I keep harping on about water, don't I? But as I mentioned, obviously water will have been withheld at some point, probably from frozen water buckets, and that could have been the whole night or even slightly longer some of the day as well. And horses can stop eating when it's really cold. You know, the number of impaction colics we see soars when we get really, really cold weather, because horses just go, oh, it's too cold to drink, or it's frozen, so I'm not going to drink, and I'm not going to move as much because it's really cold, and I actually don't really fancy eating as much either. So really you see you know, all of their intake drop, and actually that can affect the acid levels dramatically. So I would say it does slightly increase the risk. And also I think the temperature change in general can really affect things, because as much as we're saying keep everything constant, I mean, it was 17 degrees here today, but it was last week like -7 or whatever it was. So you know, we can only control things, keeping things constant as much as the weather allows us to, but obviously the sugar in the grass and things like that is going to change dramatically with the weather. So I would say that, yeah, of course, huge changes like that are going to have an effect on ulcers, unfortunately.
Yes, okay, lovely. There's a few actually coming in about ulcers in different parts of the digestive system, and it was one that we had in advance of tonight's webinar, but someone's asked specifically about duodenal ulcers. Are the causes the same? Is there any way of preventing reoccurrence? And then also, if a horse scope's clear for gastric ulcers, could they still have hindgut ulcers? And again, someone else asking about colonic ulcers. So I don't know whether you have any thoughts on ulcers in other areas of the digestive system.
So to be honest, hindgut ulcers, which include all of the small intestine, the large intestine and the rectum, they are much less well researched than gastric ulcers. You know, we can get a camera straight into the stomach and we can have a look, and it's as easy as that. But actually having a look into any part of the intestine is really difficult. You can't put a camera in because you can't access it that far, and there are methods to look at it under ultrasound, but we can only see part of it. And again, all we're looking for then is sort of a thickening, which could indicate IBS, it could indicate neoplasia, it could indicate ulcers. So we can't necessarily differentiate. I would say the most important thing to think about with hindgut ulcers is to look at the clinical picture. So if we've ruled out gastric ulcers, but they're showing signs that there could be ulcers in the hindgut, we want to look at the clinical signs, which may well be similar, but might also involve diarrhea. And then use things like ultrasounding and other diagnostic techniques like taking a peritoneal fluid tap, looking at blood samples, to lead us towards the diagnosis of hindgut ulcers. But I wouldn't say it's as easy as diagnosing gastric ulcers. And then things to point out with hindgut ulcers is that the small amount of studies that have shown that most commonly hindgut ulcers are caused by damage from other things. So it's not similar to gastric ulcers where they can be primary. Usually they are caused by another damage. For example, the most common one is parasites. So tapeworms and other worms, if they have those, or if they're again on long-term treatment with things like bute, they can definitely bring on hindgut ulcers, but much less likely to get sort of primary ulcers. So if your horse hasn't had any signs of parasites, if it hasn't had any signs, any treatment with bute, then they should be far less likely to be at risk at hindgut ulcers than they would be of gastric ulcers. And then the methods for avoiding them or preventing them is definitely the same as glandular or squamous ulcers. In horses, it's your feeding methods. You want to avoid low pHs in the stomach and in the hindgut. You know, the hindgut should be around a pH of 6.5 to 7, so pretty much neutral. So feeding low starch diets will definitely help with that. And sticking to low stress, avoiding your bute as much as you possibly can, unless required, and just treating them with the wormers when they need them, and doing regular worm egg counts is what I'd recommend.
Brilliant, thank you. I think in the study that was done in America for hindgut ulcers, it was actually done on post-mortems, from, well, samples post-mortem, so to speak, from horses at an abattoir. So who knows what they'd stress and things, dietary management had been in the run-up to ending up in an abattoir. So I think it was a little bit of a perhaps distorted picture of the incidence, and I mean, that's quite an old study now, and I think there was a follow-up one that, as you say, was very inconclusive about any feed connection or diet connection. So it's an interesting area, but I think, like you say, probably the good management practices are going to be beneficial, whatever part of the digestive system we're thinking about. Again, someone else actually asking, this was a question beforehand as well, if horses scope clear after treatment, so a horse on omeprazole and sucralfate, actually injectable omeprazole in this scenario, is it advisable, can they continue with the sucralfate as a longer term prevention or treatment, or what would your recommendation be?
Yeah, they absolutely can do. You know, I don't think the horse should probably be on sucralfate forever if you can avoid it. One, because obviously costs permitting, and two, we want to return them to a natural, normal diet. We don't want to sort of have to use sucralfate for the rest of their life if we don't have to. But I would suggest that, you know, like all of the changes that I mentioned about management and things, like I said, they need to be implemented day one of the treatment. You know, you found out your horse has got ulcers, we need to find the root cause of them and make sure that that's changed before we sort of take them off treatment. So I didn't really put it in at the end of management changes, but if you are finding that your horse has got ulcers and you're already implementing all of the management changes, nothing's changed, they don't appear to be stressed, maybe it's worth looking at other things like orthopedic pain. Have they got back pain? Have they got leg pain? Are they coming in and out of season that's making them really stressed and painful, or something else that could be causing them? And I think it's really important to look at those as well. And also, we've briefly sort of touched on it, but you know, antacids can be a good one to keep them on longer term. So your gastric support supplements can definitely help. So those are worth keeping them on. And I know that a lot of people will recommend, and sometimes I do, when we take them off that omeprazole treatment, if it's not injectable, then if it's oral, then we might drop them to a half dose or a quarter dose, sort of doing that maintenance while we drop them down so that they don't get that sort of acid surge back straight afterwards. Or if they're on the injectable, it may well be that we might swap them back onto the oral at a lower dose for a few weeks. But it depends sort of on a case-by-case basis.
Brilliant, thank you. There's quite a few people asking about oils. I'm not sure if these came in before, after, or during, but micronized linseed is a great source of you know, sort of a fat or an oil, if you like. So yes, it's certainly contributing towards the energy requirements of the horse. And because of the nature of the linseed, it's a great source of omega-3, so it tends to be a slightly more thought of as an anti-inflammatory. So yeah, that's certainly an acceptable source of oil to use, and tends to be slightly more expensive because it is such a good source of omega-3. The other thing to note about it is it's not as stable in hot conditions. It will go rancid more quickly, but in sort of moderate use, it's a great source of oil. And starch levels, yes, I agree. Whoever's saying it's really difficult to work out what starch is in feeds. If you're not making any reference to starch or a product being low in starch, there is no legal requirement at all to declare your starch level. So it's a voluntary declaration on the manufacturer's behalf, unless they are making a claim. So if they say it's a low starch feed, then they have to declare what that starch level would be. I think most manufacturers, if you contact them direct, will be happy to help you and tell you what there is in there. You can guess a lot by looking at the ingredients list. So ingredients are put on in the order of inclusion. So the most comes first and the least comes last. So if there's cereals at the start of it, then you've got a pretty good idea it's going to be, so, you know, micronized barley or maize or something, it's going to be a higher starch product and probably something that you would avoid or reduce the use of if you're worried about ulcers. I should have said, actually, I didn't put it in the presentation, but we do have a little starch calculator on our website. So if you have a feed and you know what the starch level is and how much you're feeding, you can put that in and it will tell you whether it's above or below that 2 grams or 1 gram. And it tells you, you know, it's too high, too low for those parameters. So that's quite a useful tool if you are finding it hard to work it out. But yeah, basically there isn't a minimum starch level or a maximum starch level that someone has to be able to say it's low starch. So what you would do as a manufacturer is have to demonstrate that of a similar feed, yours is lower than the average or typical feed would be if you were going to put that low starch declaration, and obviously declare what that starch level actually is. So I'm just running through some of these. Another 𝗖𝐴𝐵𝗿𝐺𝐻 ulcer one. This is an interesting one. How much learnt behaviour re signs of ulcers? So I guess some of the wind sucking and that kind of thing, and girthy behaviour is then sort of learned and carries on even if the horse doesn't have ulcers. Do you have any thoughts on that, anyone?
I mean, I think there is definitely an element of that. I think I've seen another comment or question that's similar, that's saying that my horse is just a crib biter, and definitely their vices. Some horses can pick them up and they never lose them. You know, wind sucking, sometimes actually it's the hit of the fresh air that actually makes them feel quite good, and they get sort of addicted to doing it. So I'm not necessarily saying that every horse that's showing a vice or a habit is definitely going to have ulcers, and I do think that some of it can be learned behaviour. And you know, like I mentioned with the bucking and things, sometimes, you know, you might think your horse has ulcers and then there's no ulcers there, and you look and there's no orthopedic pain, and unfortunately you're left with, oh my god, it is actually their behaviour, you know, and now I've got just a really difficult horse to deal with. So I think, yeah, definitely some of it can be behavioural and it can stick as a habit, so you just have to sort of go alongside your gastroscopes and your clinical pictures. Otherwise, if your horse seems happy, healthy, well, and you've got a clear gastroscope and the crib biting or the wind sucking sticks, then unfortunately that's just might be a learned behaviour at that point.
I'm conscious of the time, Charlotte, because it looks like you're still at work, and but there's one more question that I'm going to ask, because I think it is quite an interesting one, and we sort of touched on it a little bit, but with the fact that ulcers can start to form pretty quickly after a horse is, you know, not having access to food and forage, with the scoping and needing to withhold food, what's the, you know, could ulcers have formed overnight by the time you come to scope? What's your sort of views on that conundrum? It's a tricky,
you know, they can't form overnight, so it takes quite a long time for especially, you know, you might see some very mild reddening or some irritation of the lining. Even that probably wouldn't occur from overnight, and we're aware of that. So, you know, if it's not sparkling perfect light pink, we're not going to be like, they've got ulcers, quick, let's treat them. We will take that into account, but most of the ulcers that we're seeing and treating are, you know, they're deep craters. They're pretty obvious that they've been there for quite some time, and usually there's some evidence of scarring that's been there for a while as well. So certainly it's not, it won't happen in one night, and you know, that unfortunately that one night has to happen of starving just for the scope, but I don't find that it has any sort of long-term damage just doing that sort of 12 to 16 hour starve.
No, and it's a bit like the use of omeprazole, isn't it, in terms of feeding, and they're suggesting to feed it in effect on an empty stomach and not feed before. So it's almost a bit counterintuitive, but if you want the medication to work, you're going to get it absorbed and utilised better if you haven't got a stomach full of food, basically, I think is the general premise. And then you go back to putting your good food and management regime in place. Sorry, I said I was going to do one last question. Is scoping risky if the horse you know, had limited symptoms, would you go for, is there some less invasive way of indicating or testing for whether a horse has ulcers? What would your advice be if the client's concerned about actually doing the scope itself?
So a gastroscope is really low risk, but I wouldn't say it's no risk. Obviously, any procedure is not doesn't come without risks. We are sedating the horses, which is a risk in itself. Although it be low risk, it's still a risk. And the scoping, I've actually never had a case of it, but you do fill them with air, and then if, as much as we do deflate them, sometimes when they come out they can be a little bit uncomfortable and they can show some mild colic signs afterwards. Never had one, and I can say I've literally done hundreds, but there are reports of it. So yes, it's not without risk, but I would say it's very low risk, and there is no other way to definitively diagnose them. I'm not going to sort of open a huge can of worms, but obviously there is everybody probably has heard of it, of the pH testing of your horse's poo, or the blood testing of your horse's poo. It is available, you can get it done, but it certainly isn't anywhere near as reliable as actually getting a gastroscope done. So I would always recommend the gastroscope first if you are really thinking that your horse is showing signs of ulcers.
Brilliant, thank you. I think we will, as it's 9:30, I'm going to draw things to a close, but thank you so much, Charlotte. I appreciate your really busy working life and managing to fit in a webinar in an evening in your sort of time off. I really appreciate you taking the time to do that. So thank you very much. If we haven't answered your questions, as long as you aren't an anonymous person, we can send you follow-up and answers, because some of you got very specific things about feeding and your horses' diets and stuff. So we'll give you some personalised advice on that. But thank you, everyone. I think we went up to something like 230 people attending, which is fantastic. So thank you very much for taking the time to join us. As I said at the beginning, if any of you missed it, there is a recording. Charlotte's very kindly said we can record it, and we'll put it on our YouTube channel, and it will be circulated, the link to you all, those of you that registered. So there are more talks coming up, the 10th and the, I think, 18th of March. So do look out for those on social media, because we'd love to see you all again. And thank you very much. But thanks, Charlotte, that was brilliant. And thank you, Claire, as well. Sorry. Fabulous. All right, I'll close it down, but thank you both, and everyone's saying how good it was. So thank you very much for that. All right, take care. Thank you. Bye.
Bye.